If you're over 60 and your doctor recently congratulated you on finally hitting that picture-perfect 120/80, I need you to stop what you're doing and pay close attention for the next few minutes, because what I'm about to share with you might be the single most important thing you hear about your health all year. Researchers tracked thousands of older adults for years, watching their blood pressure, their falls, their hospital visits, and yes, who lived and who didn't. And what they discovered turns the conventional wisdom we've all been taught completely on its head. The seniors who hit those textbook numbers, the ones whose charts looked flawless, were ending up in emergency rooms with broken hips and worse outcomes than people whose numbers were considered a little too high. Over the next several minutes, I'm going to walk you through the exact blood pressure range tied to the longest lifespan in older adults, the reason the standard target can become genuinely risky after age 65, and one simple 3-minute test you can do tonight in your own bedroom that could keep you out of the hospital. My name is Dr. Alex Mitchell, and I promise you that what I'm sharing today comes straight from the research, not from marketing or guesswork. This could protect you, or it could protect someone you love who's getting older and trusting their numbers a little too much. Before I go any further, I want you to do something for me. Down in the comments, just type your age. Nothing else, just the number. Are you 66? Are you 74? Are you 83? I'm genuinely curious who's listening to this, because believe it or not, the advice I'm about to give changes depending on which decade of life you're in. And here's the part I really need you to hear. If you've ever stood up from your favorite chair or climbed out of bed in the morning and felt the room sway, even for just a heartbeat, type the word dizzy next to your age. I'm asking for a reason, and in just a few minutes that reason is going to become crystal clear, and you may realize you've been ignoring a warning sign your body has been sending you all along. Let me paint you a picture of something that's happening in medical offices all over this country, probably this very afternoon. A 79-year-old woman comes in for her regular checkup. She feels fine. Her blood pressure reads 146/85. The doctor glances at the screen, sees the guideline that says the goal is under 130, and reaches for the prescription pad almost on autopilot. One pill to start. A few months later, maybe a second pill. And it works, at least on paper. By the next visit, her pressure reads a beautiful 123/76. The doctor smiles. The chart looks great. Everybody walks away feeling like something good just happened. But here's what that number on the chart can't tell you. A few weeks later, that same woman wakes up at 2 in the morning to use the bathroom. She swings her legs over the side of the bed and stands up the way she's done 10,000 times before. Except this time, the moment she's upright, her blood pressure plunges. That gorgeous 123/76 crashes down to something like 88/56 in a matter of seconds. Her brain, suddenly starved of blood, goes foggy. The room spins. She reaches out for the dresser, but her hand finds nothing but air. And just like that, we're no longer talking about blood pressure numbers. We're talking about a shattered hip, an ambulance ride, surgery, weeks in a rehab facility, and the kind of downward spiral that, for far too many older adults, ends with the loss of their independence forever. That story isn't rare. It's playing out constantly, and a huge number of these tragedies are completely preventable. The research showing this should have been front-page news, but most patients have never heard a word about it, and honestly, plenty of doctors haven't caught up to it either. That gap between what the science actually says and what's happening in the exam room is quietly costing people their health and their lives. And I'm about to close that gap for you right now. So here's the part that's going to feel almost backwards, and I need you to stick with me, because once you understand this, you'll never look at your blood pressure the same way again. For as long as any of us can remember, the message has been crystal clear and dead simple. Lower blood pressure equals better health. And for people in their 40s and 50s, that's absolutely true. Getting your numbers under control in midlife genuinely protects you from heart attacks, strokes, and kidney disease decades down the line. That evidence is rock solid, and I would never tell a 50-year-old to ignore high blood pressure. But something profound shifts once you cross into your mid-70s. The research is showing us that older adults whose systolic pressure, that top number, sits somewhere in the range of 130 to 145, are actually outliving the ones who hit that picture-perfect number below 120. They're having fewer falls, fewer fractures, fewer trips to the hospital. And here's a surprising one. They're often holding on to their memory and mental sharpness better too. Meanwhile, the group that achieved the so-called ideal reading, the one everybody's chasing, showed more dizziness, more fainting spells, more kidney trouble, and yes, a higher risk of dying. Read that again, because it's the opposite of what you've been told your whole life. Now, if you're the kind of person who wants to understand the why behind all this, and not just be handed an instruction and told to follow it, then stay with me, because I'm about to give you a completely new way to think about your body as it ages. Here's the foundation you have to grasp. Your cardiovascular system at 75 is not simply an older copy of your cardiovascular system at 45. It has changed in fundamental ways that completely change what your blood pressure numbers actually mean for your health and safety. Let me walk you through the 3 big changes that happen as you age, and why each one demands a different approach. The first change is something called arterial stiffness. As the years go by, your arteries lose their elasticity. Picture a brand new garden hose, soft and springy, versus one that's been baking in the sun on the back porch for 20 years, hard and brittle. Your arteries go through a similar transformation. When your heart pumps a wave of blood into young, flexible arteries, those vessels expand and gently absorb the surge. But stiff, aged arteries can't do that as well. What this means in practical terms is that an older body sometimes needs a slightly higher baseline pressure just to push enough blood all the way up to the brain and out to the kidneys, especially when you're standing upright and that blood has to fight against gravity to reach your head. The second change involves tiny pressure sensors in your blood vessels, called baroreceptors. Think of them as the thermostats of your circulation. When a young person stands up, these sensors instantly detect the dip in pressure and fire off signals telling the heart to beat faster and the vessels to tighten, all within a fraction of a second, so you never even notice. But here's the catch. As you age, these sensors get sluggish. They react more slowly and less forcefully. So now imagine you've got a baseline pressure that's already been pushed low by medication, combined with these slow-to-respond sensors. When you stand, your pressure drops, and there's nothing there to catch it fast enough. That's the dizzy spell. That's the near fall. The medical name for it is orthostatic hypotension, and it's at the heart of everything I'm telling you today. The third change is how your body handles medication. Your kidneys and your liver, the organs responsible for clearing drugs out of your system, simply don't work as briskly at 75 as they did at 45. A dose of blood pressure medication that's perfectly reasonable for a middle-aged person can build up and overstay its welcome in an older body. The drug lingers longer, hits harder, and can quietly drive your pressure down further than anyone intended. So the very same pill, the very same dose, can be helpful for one person and dangerous for another, depending entirely on age and physiology. Now that you understand the why, let me show you exactly what the research uncovered, because the specific findings are what make this so powerful. The study I keep referring to followed more than 15,000 adults over the age of 75 for an average of about 5 years. And these weren't cherry-picked, perfectly healthy seniors living in some research bubble. These were real people, the kind you see in any waiting room. Folks with diabetes, people who'd survived a prior stroke, individuals managing heart disease, and people across the whole spectrum of frailty. The researchers carefully tracked everyone's average blood pressure and then followed what actually happened to them over those years. They sorted everyone into groups based on that top number. One group stayed below 120. Another sat between 120 and 130. Another between 130 and 140, another between 140 and 150, and one group ran above 150. Then they looked at who fared the best, and the answer should have shaken the medical world. The lowest death rate wasn't in the group with the lowest pressure. It was in the group sitting comfortably between 130 and 140. Not the textbook perfect number, not below 120, the moderate middle-of-the-road range. And the folks pushed down below 120? They carried a substantially higher risk of serious falls that landed them in the hospital. They had more episodes of acute kidney injury, meaning their kidneys started struggling without enough pressure behind the blood flow. And their overall risk of dying ran meaningfully higher than the moderate group. Now, to be fair, the group above 150 had their own troubles. More strokes, more cardiovascular events, exactly what you'd expect. But the genuine shock, the thing nobody saw coming, was that pressure that was too low turned out to be every bit as dangerous as pressure that was too high. The safest place to be, the range tied to the longest life and the best quality of living, sat higher than the official guidelines have been telling us for years. And that single fact has the power to change everything about how you approach this. So let me bring this down to earth with a story you might recognize. Imagine you're 76 years old. You stroll into your doctor's office for a routine visit, feeling perfectly fine. Your pressure reads 143/84. Your doctor frowns a little, points at the screen, and says, "We really need to bring that down toward 130, ideally closer to 120. You trust your doctor, so you start a medication. A couple of months later, you're at 129/78, and your doctor is pleased but suggests adding a second pill just to nudge it lower. 2 more months pass, and now you're sitting at a flawless 122/76. Perfect, your doctor says. But then you start noticing things. When you push up out of your recliner to grab the ringing phone, the world goes a little gray around the edges. When you rise from the dinner table, there's a split second where the floor seems to tilt under you. You mention it, and you're told it's just a normal part of getting older. Your vessel's adjusting a bit slower, so just take your time standing up. But what's truly happening is that your beautiful sitting number is collapsing the moment you stand. That 122/76 might be crashing to 95/60 every time you get vertical. Your brain is being briefly starved over and over, all day long, and you're walking around at serious risk of a fall. Yet nobody catches it, because the only number anyone checks is the one taken while you're sitting perfectly still in a quiet exam room. And here's what frustrates me to no end. There's a simple test, one that takes about 3 minutes, that can reveal whether your medications are quietly setting you up for a fall. It's called checking your orthostatic vital signs, and most doctors simply aren't doing it as part of a routine visit. So I'm going to teach it to you right now, so you can do it yourself in your own home tonight. All you need is a home blood pressure monitor, the kind you can pick up at any pharmacy for around $30. Here's exactly how it works. Lie down flat on your bed or sofa and just rest quietly for 5 full minutes. Don't rush this part. After those 5 minutes, while you're still lying down, take your blood pressure and write down both numbers. Then stand up and immediately, without waiting, take your pressure again while standing and write those numbers down too. Now compare the two readings. If your top number dropped by more than 20 points, or your bottom number dropped by more than 10 points when you stood up, that's orthostatic hypotension, and it's a genuine red flag. It's a sign that your medications may be too strong for your body, or that the target your doctor is aiming for is simply too low for your physiology, no matter how pretty your sitting number looks. Let me make it concrete. Say your lying down pressure is a lovely 125/78. On paper, fantastic. But you stand up and it falls to 98/64. That's a 27-point drop in the top number, and that is dangerous. It means that during most of your waking hours, when you're upright and moving through your day, your brain is running on insufficient pressure. You might feel completely fine lying in bed or sitting in your chair, but the moment you're on your feet, you're vulnerable. This is the test your doctor really should be doing at every single visit if you're over 70 and taking blood pressure medication. And if they're not, well, now you know how to do it yourself and walk in with the numbers in hand. So you're probably wondering by now, what on earth should my blood pressure actually be? Let me give you the ranges the research points to for different stages of life, but I need you to hear me clearly first. These are guideposts, not iron laws. Your real personal target has to be worked out together with your doctor, taking your whole health picture into account. For adults roughly 65 to 74, who are generally healthy and active without major medical problems, the evidence suggests a top number in the range of 130 to 140 is sensible. It gives you solid protection for your heart and brain while keeping enough blood flowing to your organs. For adults 75 to 84 who are in reasonably good shape, the research supports aiming a bit higher, a top number around 135 to 145. Notice that's higher than the younger group, and that's intentional. It accounts for those stiffer arteries and slower sensors we talked about. And for adults over 85, or for anyone who's frail regardless of their age, a top number in the range of 140 to 150 may actually be the wisest choice, because at that stage, preventing a catastrophic fall and protecting quality of life usually matters far more than chasing an aggressively low number. Now don't forget about that bottom number, the diastolic. For older adults, you generally want it to stay above 65, ideally landing somewhere between 70 and 85. When that bottom number drops too low, your heart muscle itself doesn't get enough blood during its resting phase between beats, and that causes real problems. So if your diastolic keeps coming in under 60, that's absolutely worth raising with your doctor, even if your top number looks just fine. But of course, real people are more complicated than tidy categories, and that's where this gets interesting. Picture someone who's 73, living with type 2 diabetes and a heart attack 5 years back. Their pressure reads 148/86. Should they aim for 120/80? Probably not. That's likely too low and too risky for their aging system. Should they just leave it at 150/90? Also probably not, given their diabetes and heart history. For someone in this situation, the research suggests a target somewhere around 130 to 135 might hit the sweet spot, low enough to protect that vulnerable heart, but not so low that it invites dizziness and falls. And critically, that target should be reached slowly and gently, with someone checking those standing blood pressure numbers and asking about symptoms every single time a medication is changed. Dizziness, fatigue, that foggy-headed feeling, Those are clues that the pressure is being pushed too far down, even when the chart looks beautiful. And here's something almost nobody appreciates. Your blood pressure isn't one fixed number. It dances up and down all day long. A single reading of 148/86 doesn't mean you're living at that level around the clock. You might be 132/78 first thing in the morning and 145/84 by dinner time. What truly matters is your average over time, not one snapshot taken on a stressful afternoon. That's exactly why checking it yourself at home is so valuable. It paints a far more honest portrait of your real, everyday pressure than a couple of rushed readings in a doctor's office ever could. Now you might be asking, if all this research exists, why hasn't my own doctor mentioned a word of it? It's a fair question, and the answer says a lot about how medicine actually works. Most blood pressure guidelines are built on enormous clinical trials that take many years to complete. The landmark studies that crowned 120/80 as the gold standard were done mostly in middle-aged adults. When those results came out, the recommendation got applied broadly across every age, with an unspoken assumption that what helps a 50-year-old must surely help an 80-year-old too. But only in the last decade or so have researchers started studying older populations specifically, and they keep finding that one size most certainly does not fit all. The trouble is, it takes years for fresh research to work its way into official guidelines, and even longer for those updated guidelines to reach the everyday exam room. Plenty of excellent, caring doctors are still operating on guidance written years ago, simply because they haven't yet encountered the newer findings. And there's a deeper psychological pull at work, too. For their entire careers, doctors have had it drilled into them that lowering blood pressure saves lives. It's an article of faith. Shifting to a more nuanced view, one that says sometimes a moderately higher number is actually the safer choice, asks a lot of a busy physician who has maybe 15 minutes with each patient. That kind of individualized thinking takes time and reflection that our current system rarely allows for. Let me show you just how different two people of the exact same age can be, because this drives the whole point home. Imagine two folks, both 81 years old. The first one lives independently and gets around fine, but is juggling some chronic conditions: mild heart failure, kidney disease that's reached a moderate stage, and arthritis that makes walking a little unsteady. Their pressure is 158/88. The second person is also 81, but plays golf twice a week, has no significant health problems, and feels great. Their pressure is also, coincidentally, 158/88. Same age, same exact number, but two completely different human beings. For that first person, loading up on multiple blood pressure pills carries real danger. Those drugs could drop the pressure too far, especially on standing, could strain those already struggling kidneys, and could trigger the dizziness that, combined with arthritis and an unsteady gait, leads straight to a broken bone. A wiser path might be gentle lifestyle changes first, and if medication truly becomes necessary, a single low dose with very careful watching, accepting a target around 140 to 145, rather than aggressively forcing it down to 130. For that healthy, golf-playing 81-year-old, the same number might warrant some attention, but again, nothing aggressive. Perhaps a few lifestyle adjustments bring it to 145/84, which for an active person that age might be perfectly fine with no pills at all. Same numbers, different people, different plans. There's a name for this approach, and it's a beautiful one. Treating the patient, not the number. So let me hand you a clear set of steps you can begin putting into action this very evening. First, if you're over 70 and taking blood pressure medication, get yourself a home monitor if you don't already own one. Check your pressure at the same times each day for 2 weeks, once in the morning and once in the evening, and keep a written log. That log will reveal your true average and show you patterns no single office visit ever could. Second, run that orthostatic test I taught you, lying down for 5 minutes, checking, then standing and checking right away. If you see a drop of more than 20 points on top or 10 on the bottom, write it down to bring to your doctor. Third, take an honest inventory of how you actually feel. Are you getting lightheaded when you stand? Are you unusually tired or having trouble concentrating? Those could be your body telling you the pressure is being pushed too low, even when the numbers seem fine. Fourth, make an appointment with your doctor for the specific purpose of discussing your target. Don't just accept a blanket order to hit 120/80. Ask, point blank, what number is right for me given my age, my other conditions, and how I'm functioning day to day. Bring your home log. Bring your standing measurements. Walk in as an informed partner, not a passive passenger. And fifth, if your medications are making you feel rotten, speak up, loudly and clearly. So many people quietly assume the dizziness and exhaustion are just the price of getting older. They're not. Doses can be lowered, drugs can be swapped, targets can be adjusted, all while still protecting your heart. You do not have to suffer in silence. So let's pull it all together, because you now understand something that most people, and even a good number of healthcare providers, haven't fully grasped. Blood pressure targets should never be one size fits all. A 45-year-old and an 85-year-old simply should not be held to the same yardstick. For older adults, especially past 75, a top number somewhere in the 130 to 145 range is tied to the longest survival and the best quality of life. Push below 120 and you raise the risk of falls, fainting, kidney injury, and possibly even cognitive decline. Climb above 150 and the cardiovascular dangers rise. The safe harbor sits right in the middle. You've learned that orthostatic drop, that plunge in pressure when you stand, is often a far greater threat than a moderately elevated resting number. You've learned how to test for it yourself, tonight, with a $30 device. You understand the real reasons your aging body needs different targets, stiffer arteries, sluggish sensors, and a slower handling of medication. And most importantly of all, you now have the knowledge and the language to walk into your doctor's office and have a genuine, informed conversation about your own care. You're not just nodding along anymore. You're an active participant in protecting your own health. And that, my friend, is a powerful place to stand. Honestly, you now know more about blood pressure in older adults than the vast majority of people your age. You understand the nuance. You know that one size doesn't fit all. If this gave you clarity, if it answered a question that's been nagging at you, or if it gave you the confidence to speak up for yourself, then I've done exactly what I set out to do. So go ahead and drop a comment saying informed. And if you feel more ready to talk this through with your doctor, please share this with the people you love who are 65 and older. They deserve to know this too. In my next video, I'm going to dig into the 3 supplements that actual research suggests can genuinely support healthy blood pressure, and the 2 wildly popular ones that are nothing but a drain on your wallet. You're going to want to hear that, because the supplement world is absolutely flooded with empty promises, and I'm going to lay out exactly what the evidence really says. I'll see you there. One last thing. Everything I've shared today is for educational purposes only, and it is not a substitute for medical advice. Your blood pressure plan has to be tailored to your own complete medical history and current health. Please never adjust or stop any medication on your own without talking to your healthcare provider first. The information here reflects current research, but it should always work alongside, never replace, the care of a qualified doctor who knows you. Take this knowledge, bring it to that conversation, and take good care of yourself.